Good morning. Welcome to a live talk program. This is Lloyd Grubb here, your host on Revive Reform Radio, doing our live talk program covering natural health on your Wednesday morning Rise and Shine. Natural health we're covering this morning here as we do our live talk program. And the topic we're looking at is bone fracture risk may not be lowered by vitamin D supplement. So bone fracture risk may not be lowered by vitamin D supplement is what we're looking at here this morning as we do our live talk program. So welcome again. Hopefully you're the blessed IRS and you're ready to take on today. And the information we're sharing here will help you take your day on better and do better. So let us pray. Our Father, who art in heaven, we thank thee again for your word. We thank you for the blessings of this day. Pray that you may be with us, dear Lord, as we partake of some natural health, and may we be healthier, happier people. We pray for Christ's sake. Amen. So again, our topic for this morning here, as we do our live talk program, is we're looking at this topic: a bone fracture risk may not be lowered by vitamin D supplement. As you've been noting here, and I have one quick article I want to share with you before I get into the main talk about calcium and the sources of calcium and so forth. And as you've probably been noticing, there's been a constant line of research that keeps showing that taking a vitamin, especially long term, can have adverse effect. And so it's important for you to consider, if you're on any type of vitamin, that moving forward, you know the risk and you know the benefits short term, but long term, you understand that you have to find more natural sources to deal with this problem. And if you do that, you'll find that you'll be all right and you'll get the benefits that you're looking for. So contemplate that well. And if you do that, as I say, you'll get some benefits other places. And so we're going to talk about some of the places you can get your calcium from other than the vitamin supplement. And if you can have other places you can get your nutrients from to deal with the problems that you deal with, then you will be able to be in better health. So that's what I want to encourage you this morning as we do our live talk program. But before I get into that, I'm going to be sharing some information here about this article, this quick article I want to share with you here about some ongoing problems that people are experiencing via marijuana use. So I want to share that with you here so that you can get this information for your own use and also to share with others. And then I'll get into the calcium discussion, which is the main thing I want to talk about here this morning. So here, this is from Kaiser Health News. So this is from Kaiser Health News, and this is entitled Wrecked and Wretched. Obscure vomiting illness linked to long-term pot use. So obscure vomiting illness linked to long-term pot use. For 17 years, Calfonte Lene Queen suffered periodic episode of violent retching and abdominal pain that would knock her off her feet for days, sometimes leaving her writhing on the floor in pain. And I'll pause there. So this is something to do with vomiting and screaming and all that connected to marijuana use. And in some of the articles I read, the doctors label it scromiting because the person is screaming and vomiting at the same time. Continue the article, it says, I've screamed out for death, says Queen, 48, who lives in San Diego. I've cried out for my mom who's been dead for 20 years, mentally not realizing she can't come to me. Queen lost a modeling job after being mistaken for an alcoholic. She racked up tens of thousands of dollars in medical bills, and her nausea interrupted her sex life. Towards the end of her illness, Queen, who stands 5'9", weighed in at a frail 109 pounds. So one could understand why screaming and vomiting would interrupt somebody's career, sex life, and would cause them to get to a 109 pound for a 5'9" frame female. Throughout the nearly 2 decades of pain, vomiting, and mental fog, she visited the hospital about 3 times a year, but doctors never got to the bottom of what was ailing her. By 2016, she thought she was dying. That she must have some sort of cancer or something they can't detect, Queen said. But she didn't have cancer. She had an obscure syndrome called cannabinoid hyperemesis syndrome, a condition only recently acknowledged by the medical community. It affects a small population, namely a subset of marijuana users who smoke multiple times a day for months, years, and even decades. There's no hard data on the prevalence of the illness, but in California and Colorado, which have loosened marijuana laws in recent years, emergency physicians say they're seeing it more often. One study in Colorado suggests there may be a link. Dr. Amy Mullin, emergency room physician at the UC Davis Medical Center in Sacramento, said she has seen a rise in the number of cases in California. Voter legalized recreational marijuana last December. She expects to see another increase after commercial sales are permitted starting this month. Doctors say it's difficult to treat the condition. There's no cure other than to quit using marijuana, and many patients are skeptical that cannabis is making them sick, so they keep using it and their vomiting episode continue. Doctors can do little to relieve the symptoms since traditional anti-nausea medication often don't work and there are no pills to prevent the onset of an episode. Parents may need intravenous hydration, Patients may need intravenous hydration, and hospitals stay until the symptoms subside. That's really frustrating as an emergency physician, says Mullin. I really like to make people feel better. Diagnosing the syndrome can also be frustrating and expensive. There is no better test to link the stomach ailment with marijuana use, so physicians often order pricey CT scans and lab tests to rule out other medical problems. Cannabinoid hyperemesis syndrome was first documented in Australia in 2004. Physicians have historically misdiagnosed it as the more generic cyclic vomiting syndrome, which has no identifiable cause, or as in Queen's case, acute intermittent porphyria (AIP). 5 years ago, this wasn't something that doctors had on their radar, says Dr. Kenny Hurd, emergency room physician at the University of Colorado in Aurora, who co-authored the Colorado study showing a possible tie between the liberalization of marijuana and a surge in the vomiting illness. We're at least making the diagnosis more now. One surefire sign of the illness is when patients find relief in a hot shower or bath. Queen said she would vomit repeatedly unless she was in a hot shower, so she'd stayed in there for hours. Toxicologists say the heat may distract the brain from pain receptors in the abdomen, but like the syndrome itself, that phenomenon is not well understood. The exact cause of the condition is still a mystery. Toxicologists say the chemical compound in the marijuana may throw off the normal function of the body's cannabinoid receptors, which help regulate the nervous system. Some people may be genetically predisposed to the syndrome, or marijuana potency or chemical makeup may have changed over time, says Dr. Craig Slomin, medical director of the San Francisco Division of California Poison Control Center or System, who also work on emergency physician at the Zuckerberg San Francisco General Hospital. The vomiting link to cannabis in is counterintuitive to many, because it is a widely known reputation as an anti-nausea remedy for cancer patient. A lot of times people just don't believe you, says Dr. John Colburn, an emergency room physician at Kaiser Permanente in South Sacramento. Even after being told that quitting may help, some patients will visit the hospital multiple times before they stop smoking marijuana, Colburn said. I can't really tell you why. I mean, why do people ride motorcycles without helmets on? And right there in the note there, they make sure, point out that Kaiser Health News and Kaiser Permanente are two different organizations. They're not connected. Cameron Nicole Baird, 19 of East Moline, Illinois, said she struggled to believe her doctor about the link between pot and severe vomiting. Who wants to be told you can't smoke marijuana? When you think marijuana can help, she said Baird, while recovering from a marijuana-related vomiting episode at the University of Iowa hospital in Iowa City, Iowa, in October. She said she had lost 20 pounds in 10 days. Although there's still no magic cure for patients marijuana-related hyperemesis, Mullins said, and other doctors say they're regretting, they're getting sort of better at treating the symptoms using old antipsychotic medication and creams for the muscle ache. Dr. Hurd said the cases in Colorado seem to have leveled off, but without hard data, and because overall numbers are small, it's hard to say for sure. Hurd said he doesn't believe cases of pot syndrome increased by recreational use when it was legalized in 2012 because chronic users probably already had medical marijuana card. Calfonte Lene Queen is still struggling to completely quit marijuana, but her symptoms are down to a dull stomach ache. She smoked a couple of times a day compared with her near constant use in the past. She said it's the only thing that works for her depression and anxiety. Queen is back on a healthy weight and hasn't been to the hospital in a year. She said she wouldn't want to discourage anybody from smoking weed. She just wants people to know heavy use can bring them some serious misery. Now, if I get sick, as sad as I'll be and as upset and disappointed with myself as I would be, at least it's my choice. Right? So, story was written by Pauline Bartalone from the Kaiser Health News. All right, so here you have this situation. So, as the young lady says here, or the grown woman, Queen here, Lene, as she said that she would not want to discourage people from using marijuana. Well, as you know here, I'm discouraging people from using marijuana. It's no good. And these are just headline news. I'm not actually, I don't really go to my way to find these news. If you go on, Kaiser Health or NBC News or any of these major news network, you see this stuff all the time pop up. And probably right next to it, you see something like this morning. If you go on USA Today, you'll see an article saying the Mike Tyson is going to open up a farm. He's already broken ground to open up a marijuana retreat or farm or something like that, where I guess you can grow and smoke the weed just like you do for Christmas. In Christmas time, people go to farms in my neighborhood here and they go buy Christmas trees. They cut it down and then bring it home. So I guess you could just go to the farm and go get your whole tree of weed. Or you can stay there and drink. So this is what it is going on. So there's this constant push and encouragement and investment from people with a lot of money to invest in weed. Just like I can imagine back in the turn of the previous century, where tobacco was just constantly being pushed. And what we had how many decades later was just a whole bunch of people dying from lung cancer. Here we go now with marijuana. Now, as it noted here, marijuana affects the cannabinoid receptors in the brain. And this problem could be one of the reasons why they're thinking it's causing the vomiting, because it's affecting the way the nervous system work. It is something that, as I say, it's similar to the tree of the knowledge of good and evil, and it affects it in a way that is a possibility that is damaging the nerves and the receptors, and long-term or heavy use will cause this problem. Some marijuana users, or many marijuana users, believe this is caused by the pesticide in marijuana. So the pesticide in marijuana, they believe it's could be the reason. Well, as they note, in 2004, it cropped up or was diagnosed in Australia, and now they're having it here, and I'm sure other places. So that's significant because it could be that the world over, as they discover this reality, as marijuana use become more prevalent, that the world over they're using the same pesticide, and so the gut is responding to the pesticide. It's a possibility. But then a possibility, as the doctors have said here, that is a possibility that because marijuana affect the receptors in the brain, that it could be damaging the brain. Now, if you've been with me here, I'm sure you remember I've shared information that the brain and the stomach has a lot of receptors, that the feel good that we get from food is not just the nutrients, but it's that there's so many receptors, feel good receptors in our stomach, that those receptors are stimulated when we eat. So we just don't enjoy the food when they're in their mouth. We also enjoy the food when it goes on into our stomach, because it stimulates these receptors so that we feel pleasure. This is why a person can love the full feeling, because they love what the food does to them in their stomach, and they become very addicted to that. So why is that important? Because the receptors are connected, and so when you have these receptors can be damaged. And so I believe that is a possibility, what the doctor is saying, if they keep going on that line of reasoning and study, that they might find that it is not just the cannabinoid receptors in the brain, but in other parts of the bodies that was made to get feel good from even what we consume that is being damaged. So keep that in mind, as you know, the use of marijuana increase similar to tobacco, and you will find more and more problem. And keep in mind, I've said it here over and over again, that one thing is important to remember: unlike tobacco, which does a different type of damage to the body, marijuana is primarily a nerve damaging plant. It basically kills the nerves, it tranquilizes the system. So keep in mind that. So as we move forward, I don't even gonna guess. I said it here before. Articles like this you will see, and issues like this will come up, where the marijuana is on a national, international basis is damaging the nervous system, because that's what it does, and you will see more and more weird diseases and problems that are coming up in heavy marijuana users, because some people, they don't have a great tolerance for anything because they have a weakened constitution. You will see that it will come up more and more where there's nerve problem, all kind of erectile dysfunction, all kind of severe mental depression, neurological problems. All of that will be coming up. So just watch. As I say, as you stick here with me, you will see. I'll just keep sharing more and more articles. You're gonna see they're more linked towards nerve damage and neurological damage. This is what happens. So we move on to our main topic here for this morning. Here is bone fracture risk may not be lowered by vitamin D supplements. So bone fracture risk may not, and I would say I don't believe it will. Now, if you remember, I've said this before. If you've seen over and over again, they'll keep coming out with a new research on a new vitamin. When I say vitamin, a synthesized or chemical vitamin, And what you'll find is that the research keeps saying it causes one problem or another problem, or it causes cancer or so forth. And so it's important to know that if you're on any vitamin, that you always have to look for natural sources, natural supplements to use, because the vitamins in themselves are not natural and the body is not made to take in rocks or to ingest chemicals. We're not made to ingest rocks and stones and dirt. And so if somebody go into a mine and dig up a vitamin and give it to you, it might do something for you temporarily, just like how fertilizer will help the soil or the grass or trees temporarily, but long term it will cause severe damage. So keep that in mind. So again, to the article here now. Vitamin D calcium supplement may not lower bone fracture. So both vitamin D and calcium supplement, and I should correct that also. Older adults who take, and this is from Reuters, older adults who take vitamin D and calcium are not less likely to break their hips or on a bone than peers who don't use these supplements, research review suggests. Researchers examined data from 33 previous trials with a total of more than 51,000 people aged 50 or older who were living in the community, not in nursing homes or other institutional settings. They found no difference in fracture risk among people who get no treatment, a placebo or dummy pill, or vitamin D and calcium alone, or in combination. It is time to stop taking calcium and vitamin D supplement for the community dwelling older adults, says lead study author Dr. Jigo Zhu, as researcher at the Department of Orthopedic Surgery in Taijin Hospital in China. Vitamin D helps the body use calcium to support bone health, and many older adults are advised to take one or both of these supplements. The recommended daily intake of vitamin D for most adults is 600 IU international unit and 800 international unit for age 70 and older. The guidelines should be changed, says Zo. And he says here, we think that improving the lifestyle, getting enough exercise and enough sunshine, and adjusting the diet may be more important than taking these supplements. And I pause here again, because notice they're saying here simply improving the lifestyle. So when you improve the lifestyle, you get the results that you want. Getting enough exercise, sunshine, and adjusting the diet. These are the best source for vitamin D and also for calcium intake. Some people can get enough vitamin D from spending time outside, and older adults can also lower their risk of falls and fractures by doing things like maintaining a healthy weight or doing exercise designed to improve balance or coordination. So you just think about that again. Maintaining a healthy weight. If you're the same bone structure, and if you say the bone structure doesn't change, but you have 150 pounds extra on your 100 pounds, that's 100 pounds, although evenly distributed all across your body, that your hips, your basic bone anywhere below your hips, all the bones have to be able to maintain. And so you're walking around basically with a lot of weight. This is what's gonna, in a big way, I believe, increase the likelihood of having a fracture. Because say you come down hard, all that extra poundage is gonna land, and you don't have to deal. Say you have a fall, a trip, a slide, anything. It's a lot of weight for your body, the bones to stop, and especially as one gets older. It says here the guidelines should be changed. He says some people can get enough vitamin D by spending times outside. When people take daily vitamin D dosage of 1,000 international units or higher. However, they run the risk of serious side effects, particularly when used in combination with calcium. Some previous research have linked high dosage of vitamin D to an increased risk of fall, fracture, kidney stone, certain cancers, and premature death. So interesting. Notice again that there's a constant findings coming out that various different supplement, vitamin E, vitamin D, all these various different supplement increase the risk of cancer, but also noticing their kidney stone, because most of these vitamin are actually compressed with what you call calcium, dicalcium, which is basically rocks, and are similar to that, and they're compressed like that to make the tablet, and so the kidney now has to process all that rocks, and as you process that rock, it becomes clogged up in the kidney. So it's important to take a kidney and cleanse to get rid of all that stone out of yourself. All of the trials looked at the risk of hip fracture, spinal fracture, and other type of broken bones. The lack of association between calcium and vitamin and fracture risk was not in both was seen in both men and women. Regardless of supplement dosage and any previous history of fracture, researchers report in JAMA. One limitation of the study is that some of the trials in the analysis didn't include pre-treatment measurement of vitamin D blood level, which might have influenced how much the supplement impact fracture risk. Some of the trials also were not high quality experiment, the author noted. Even though severe calcium and vitamin D deficiency can contribute to loss of bone density and an increased risk of fracture, people with this problem are typically too sick to be included in clinical trials, noted Dr. Kurt Kennel, a specialist at the endocrinology, metabolism, and nutrition at the Mayo Clinic Research in Minnesota. So important to know that they're not talking about people that are severely sick. They're not talking about people that are in institutions, so they're more like bedridden and all that. They're talking about people 50 and older that's in the community. They're living by themselves there, going to the store, they're doing various different things. And they could not see any benefit, more so they see adverse effect. A key message, which is not new but reinforced by the study, is that menopause women and older men with osteoporosis should not equate calcium and or vitamin D supplementation with adequate treatment to reduce their risk of osteoporotic fractures, says Kennel, who wasn't involved in the study by email. He said, osteoporosis or a loss of bone density occur naturally with age and can also be accelerated when women go through menopause. When people do need more vitamin D or calcium, they should look at their diet first. So diet is most important. Pretty much every guideline states that dietary calcium is the initial approach to obtain adequate calcium. Thus, in that regard, no change to the guidelines are needed. People who already take supplements shouldn't stop without speaking to their doctor. Routine initiation of calcium and vitamin D supplementation in older women and men for prevention of fracture should not be advised, Kennel added. Said in the article there. So here is this thing here, right? So this is the supplementation with vitamin D and calcium. As you know, this is vitamin D is suggested because vitamin D help the body metabolize or uses calcium better. But yet either by themselves or together, not only did not show any increased benefit, but also it shows increased risk of cancer, kidney stone, and other heart problem. Because what it is, you're taking is something in your body that's clogging, and then your body now has to deal with the clogging effect of this product or these product. And then there are chemicals, you're taking in chemicals, and chemicals for the most part, they're not natural and organic, they're poisonous. That's just the reality. You notice there it says here you should speak to your doctor. So much as if you speak to your doctor is not familiar with this information, you probably need to bring your doctor and say, hey, here's a review of 33. Here's an article talking about a review of 33 different whatever. Should I stop? But the idea here, as you listen to me, is not just to tell you to stop, it's to tell you what are your options. So what is it your options are? So let's give you a little background of calcium, and then I'm going to tell you a little bit about what the calcium is doing, and then give you some options. What should you do in place for dietary? Because calcium is one of those nutrients that is probably, I would think, easier to come by. You'll see in a few minutes why I say that. It's not such a nutrient that it is hard. There's some nutrients that is harder to come by than others. Calcium is not one of them. Vitamin E is not one of them. So you have plenty of good source. So calcium performs a number of basic functions in your body. Your body uses about 99% of its calcium to keep your bone and teeth strong, thereby supporting skeletal structure and function. The rest of the calcium in your body plays a key role in cell signaling, blood clotting, muscle contraction, nerve function. Cells use calcium to activate certain enzymes, transport ions across the cellular membrane, and send and receive neurotransmitters during communication with other cells. As an electrolyte or a particle that helps conduct electricity in the body, calcium is also one of the key players. One of the key players in maintaining regular heartbeat. So for all these reasons, it's important to take it. Now, your best source of calcium, as I noted here, is dietary calcium. Dietary calcium is important, but it's important to note also that extra calcium doesn't go to strengthen bones, but instead can build up in the arteries, causing heart disease, and in the kidneys, causing kidney stone. So if you're a person that has problem with kidney stone, it's important to note that one of your first thing to deal with the kidney stone problem, other than taking herbs and doing other type of cleansing to rid the body of the stones, is to actually stop taking these calcium supplements, because again, the body has to be able to get rid of all that stone, those dicalcium. So the extra calcium is not good. So normally back a few years, quite a few years, when I remember learned about a lot of this, there would be these weightlifters, bodybuilders, various different people who are into health. They promote mega dosage of everything. So they forget that a major part of what you get as nutrients and health is from your diet. So they will promote mega dosage. So they basically saying if your body needs 1,000 mgs of calcium, what you need to do is do probably 5,000 mgs, and that's what will fix the problem. And what you realize is that creates more than what the body is, and it will cause you all kind of problem in your digestive tract with any vitamin, because overuse basically creates more problem. So keep that in mind. So the extra calcium does not do anything much other than goes into your arteries, clog up your arteries, goes into your kidneys, because your kidney have to process all that junk, and it clogs it up and creates more problem for you than give you solution. It is suggested that women over 50, that was the target group for the article, that's a woman that's going into menopause, are advised to get 1,200 mgs of calcium a day, and women under 50, 1,000 mgs a day, milligrams a day, right? So this is where you would get it. Men normally 1,000, men over 70 normally 1,200. So anywhere from 1,000 to 1,200 is the normal recommended dosage of calcium. Most naturally, vitamin D makes the body uses calcium better, and so some of your best source of vitamin D is actually sunlight. More difficult to get in the winter, easier to get in the summer. The reality though is that says most Western diet does not have enough calcium in their food, and so this is why you can see a person have a bone density problem where their bones are not very dense, so they're very have high risk of hip fracture, but yet they might be 200, 300, 400 pounds. Somebody say, well, aren't they eating out of milk and dairy, cheese, cheese, dairy, and other stuff with all the calcium, drinking bone broth and all kind of stuff like that, and yet they're still calcium, their bone is not dense because again, it's the source. Quality means a lot. Not all oils are the same. Some oils are very good and they lower inflammation. Some oils are very bad and they increase inflammation. Back in the past, again, I remember when we came into this, everybody would talk about this idea that it's just protein is a protein, carb is carb, fat is fat. And then over the years, they found out that there's good cholesterol, bad cholesterol, good fat, good carb, bad carb, good protein, bad protein. And then you quickly start realizing that not all is the same. Not all calcium is the same. Calcium is not all made the same. There's calcium from natural sources and calcium from sources that are damaging. There's vitamins from various different sources. So if you want good vitamin E, you get it from natural source. You'll find that you'll do much better. So not all is the same. And so the diet is your primary source. The diet is a primary mode of attack here. And so Western diet does not provide a lot of this. Also, you find that people who drink the most milk, big milk drinkers, have the most bone fractures. And this is the problem here. Also, your risk of death overall is increased by the more milk you drink. So you would think the thing that they advertise for calcium would be the thing to partake of the most. So you say, well, who gets the most broad hip fractures and fractures in general? People who drink high amount of milk. This is what the studies have borne out. So it's the actually counterintuitive. The quality has everything to do with everything. So somebody say, well, I'm taking in more volume. More volume of garbage doesn't mean that you're doing better. Somebody could say, I'm a avid reader of books, as a good example. And a person read, say, a book a week. Every week they pick up books. So when they finish the year, they read 52 books. You could read 1 or 2 books for the year and you're more sensible, more intelligent, wiser, just better intellectually. Somebody say, how is that possible? Do I need to explain? Not every book is the same. There's a lot of books that's just junk information that make you confused. They're just junk. But if you're reading 52 good books, you're going to be ahead of the game of a person who read 2 books for the year. So it depends on the information. So you can have a person that is, you ever heard people say this, that they'll say, if a person is sick and they're 100 pounds overweight, they'll do better in the hospital than a person who has the right amount of weight on, or even underweight. You ever heard that? So think about it again. It's not apples to apples. It's just a weird way of thinking. A person who is sick is going to get sicker and more likely to die who is overweight than a person who has the right amount of weight on, or even underweight. And when I say underweight, not severely underweight and anemic, but I'm talking about the body doesn't have a lot of, stuff to deal with. So it's important for you to understand that. Because the person who is already overweight is always sick anyhow. They're always just, on a weekly basis, they're close to dying. So it's the same thing. The more milk is the more fracture. So again, another important caveat here. If you're having bone fracture, the solution, the first thing you want to go for is to not grab your milk, but probably grab some almond milk, soy milk, coconut milk, rice milk. You'll do better. And automatically just cutting off cow's milk is great. You will reduce your risk of death, early death, and also of bone fracture. And that's the big thing about it with life here. It's about the quality of life. Somebody say, well, look at my aunt Tilly. She's 80-year-old and she's been smoking. Yeah, but she had a horrible existence. What's the point? Who wants to live to 80 and live to 80 and somebody can pick you up with their pinky, because you're really thin and you're about to basically evaporate with the smoke you're smoking. There's no point in that life. What's the point? Is like it's to me that's just useless to live to 80 and suffer like that and live a life as a fiend, a drug addict. That's not it. That's not life. I can't see the value of that. But people will argue that stuff. And the weirder part is even to watch people in churches argue that. It's crazy. So clinical trials in calcium supplement 1,000 mgs a day, however, as it's stated here, has showed cardiovascular events increase. So more cardiovascular problems, circulation is being clogged by all the stone rocks and poison. Kidney stone, most naturally. More hospital admission for acute gastrointestinal problem. So it damages the digestion. So the person is always having digestive problem. So if you know a friend, a loved one that having these problems, just tell them, stop eating that rocks. Just get off all those chemical supplements and then start to partake of some plant-based milk and cheese. And that will start fixing the problem, start unclogging themselves. You can look at a person, you can just tell they're clogged. If you don't know how to then talk to me privately, I'll explain to you. You can just see it. And I can just look at a person and tell all the different type of disease they have. And it's no funny business. It's just, if you know what to look for, you can just tell. So most dairy source is the big part of the problem, and the more dairy source a person partake of is the more translated to more broken bones. The less they have is the less broken bones. And over the years they have shown that it is the more dairy animal-based calcium is, the more it increases the chance and risk of cancer. So now to the main deal. What's your dietary source for calcium? Again, remember, female normally is 1,000 to 1,200. Male is 1,000 to 1,200. Depends on what they're dealing with at their age. So we see here the number one source per milligram per cup. A cup of cooked collard greens can be the top of your list. Right behind it is bok choy. So cook collard greens. So you take some collard greens, you cook it down, you get a cup. 1 cup of that is 289 milligrams. That's a little bit about 28% of what you need for the day. So just 1 cup. So this is why I say calcium is one of those things that is easier to come by. Probably not the best tasting collard greens, but you can quickly get used to collard greens. If you can't, well, you probably could cook it down with some coconut milk or some seasoning. And don't cook it to death, but cook it down. And you have some collard greens. So you get that collard greens in, and you have 28, almost 29% of what you need for the day. So your one meal, you have a cup of collard greens in it. And within that one meal, you have 29%. You didn't eat nothing else yet. Just that one meal for the day. So this is not necessary for a person, to me, for calcium, to be taking calcium. Supplementation. What the person needs to do is cut off the milk, cut off the all dairy, and start taking the supplementation by basically eating. So we had 1 cup of cooked collard greens, 1 cup of bok choy, 250, 25%. Turnip greens will give you 252 again, 25%. Sesame seed, 2 tablespoons, 210%, 21% of your daily needs. 2 tablespoons. Actually, I had some. What did I just had? I just had some sesame seed in my food this morning for breakfast. So that there goes. Might have 2 tablespoons, but I'm just saying. I have some calcium. Kale comes in at about 210 milligrams. Almost 20%. Now to compare, to give you an idea, a cup of cow's milk will give you 197 milligrams, right? So if you see that there, I should have put here soy milk. Do apologize. I should have put the comparison. but just showing you that 1, 2, 3, 4, 5 things comes in higher than cow's milk per cup. So, but all these are dietary source, but the cow's milk will increase your chance of fractures, kidney stone, acute gastrointestinal problem, cancers, coronary artery problems. So you can get almost 20% from cow's milk, but also with that comes a whole slew of health problem, higher bad cholesterol, more clogging of the arteries, so forth. Mustard greens, beautiful looking, nice tasting mustard greens with the bitter taste and all that, everything in there. You get 197%, almost 20 pounds, 193 with a cup. Watercress, you add that to your salad, 189 per milligram. Breast milk, this is why children should drink milk, or babies, not adults. But breast milk here, I'm not encouraging you to go buy breast milk and drink it or to get it from your spouse, but I'm just saying breast milk is 184. So this is why milk is good for young, whatever. Almond is half a cup of almonds. So you can just get half a cup of almond. That's just a little bit more than a handful. Would give you 160 mgs. So I'm going to add this all up in a second for you here, show you how this works. Broccoli, which I had some broccoli for breakfast again, will give you 140. Then I'm just not gonna give you all the rest, but garbanzo, black kidney beans are top on the list there. Molasses, 1 tablespoon, 137. Tofu, 4 ounces, 130. Sunflower seed, 2 tablespoon, 124. Carob, 4 tablespoon, 120. Parsley, buttersquash, buckwheat, soybean, half a cup, 66. Dates, apricot, 50-50. And figs down there. All right, so that's the list we're working off. There's some things here I would add to this list. I'll do in the future. Let's just break this down now a little bit and just look at the meal here. So in our meal here, you have the meal. So your first meal in the morning here, you have some broccoli, so I'm taking this here, some tofu, you have some rice. So broccoli, tofu, and rice. So you have your tofu 4 ounce. So that means a pack of tofu is normally 16 ounce. So you have 1/4 of the tofu. You have 130, right? So 130 mgs. So I'll go with some of the lower ones. Then you have some broccoli. You get a cup of that, and it's 140. And then you throw in there some rice. I don't have what the rice is. So that's your breakfast there. You have 27% of your daily needs, right? 27% of your day just from one meal. So for lunch now, you decide I'm going to do a cup of collard greens, right? And you're going to have some collard greens, and you're going to have that with, I don't know, collard greens don't good with bread. So you just have it with some bread. We keep it there. So we had 56% now, all right? And then in the evening now, you decide that you're gonna have some dates. You're gonna have less than half a cup. You're gonna have probably 1/4 cup of dates, 25%. And then you're gonna have some almonds with that. You're gonna have some almonds. So I'm just putting 100. I won't put in a whole half a cup. You have less than half a cup of almonds. And you blend it up, and you probably throw in some soy milk, which I should have had there. It's because it's from tofu, so I'm going to add another probably 75. All right, so I'm up to 76%. So 76% without calculating all of the stuff, the rice and everything like that. So you see how quickly there is. You could get up to 100 milligram. If I take in some of the other high stuff, and I throw them in there, you could see how quickly you could add up. And with just me grabbing a few things off this list, if you're having a healthy diet, it's going to be easy for you to have 1,000 to 1,200 mgs. And that's normally how you have to calculate this. And it is easy to calculate like that because, see, most of the time people are eating a high volume of certain things. So, as I say, 4 ounces of tofu is about reasonable. Broccoli, almond, all that stuff is just reasonable to eat. So, me just grabbing a few things off this list without going to, if you're using milk, if you're using, like soy milk and other things and other food source that have it, you can see why just me selecting about seven, probably 6 items, I can come up with almost 75, and I could add one more high hit item. Like as I say, in my breakfast this morning, I had sesame seed, so I probably added a 50 in there, and one or two more items, and I'm at 1,000 mgs. So this is where you normally want to take your source. Now it's important to contemplate this and to consider how you eat like this, because when you eat a nourishing diet from various different sources of fruits, nuts, seeds, grain, vegetables, what you're gonna find is that it's easy to get 1,000 mgs or whatever mgs you need of various different supplement. And by doing this, what you're doing is that your diet now become your food source. Now, if you're badly undernourished from a certain foods, then it's gonna mean that you're gonna have to step up your game on that source. Or you could find supplements that are made from natural sources, and you take those supplements as a supplement. In other words, if you see here, why I did it's called so conservative. Say you have a natural supplement, and the supplement state that is taken from plants, seeds, grains, nuts, wherever, and the supplement say will give you 50, 75% of your daily need. That's all it is just a supplement. And I go online and I'll buy sometime certain type of supplements with certain nutrients, because if you're a person and you're really feeling like you're having a bone loss problem, a bone density problem, and you say, you know what, Ben, I'm going to start going outside because I want my body to get some sun so I can utilize calcium better. And then you start to follow these dietary suggestions I have here. And so you go for it and you decide, I'm not going to go on the low things that Lloyd suggested on the list. I'm just going for the big hit. I'm going to go for, first thing in the morning, instead of doing broccoli, I'm going to do, because if I change the numbers and I did 1 cup of collard greens, and I'm gonna go for that. I'm gonna start my day with 1 cup of collard greens. I'm gonna throw in there some tofu. I'm gonna throw four ounces of tofu, and I'm already at 40 something percent of my daily need of vitamin. Just one meal, as I say, 1 cup of collard greens, 4 ounces of tofu. You had 41% or 42, almost 42% of your daily need of calcium. And then you have a calcium supplement, and that calcium supplement is not from coal tar derived or from some shell or from some rocks. It is a calcium supplement that they literally made from plant. And in that calcium supplement, you had 50%, so 500 mgs of calcium or whatever the thing you're in need of. You could find real quickly that you're up to 900 or something mgs for the day. That's what a supplement is. So why I mentioned earlier, just to kind of tie up the thought here, why I mentioned earlier that back in the past when I started learning about this thing, people believed in mega dosage. You don't need mega dosage. What you need is to be able to have a source where you can get just a natural source that you have your diet is healthy, but you probably need a natural source. You can get 50%, 75%, even 100% of the nutrient, even 25%. And what you'll find is that you could take a supplement that is natural and it is 25%, and you take 2 of those instead of 1 a day, 3 of those a day, if you're badly need, and you would end up ahead of the game, because what it is, it's a supplement. It's not your diet. Your diet is going to be the broccoli, the bok choy, the turnip green, the sesame seed, the kale, the molasses. And so This is what it is. If you're female and you're female, you feel like you have an iron deficiency or any deficiency. I'm gonna tell you now how quickly before we close here you get to 1,000 mgs. You take a cup of any of the first five. So I'm gonna do collard greens. You take a cup of collard greens. Then you take in some molasses. Molasses is 130 something. You take a tablespoon of molasses. 130, 137 plus 289. And then you take in, say, 4 ounces of tofu for the day. 137 again. And or 130. And with that, you had 56%. And that doesn't count the rest of the day. Just by doing that, just a cup of a cup of collard greens, a tablespoon of molasses, 4 ounces of tofu. Say that was how you start your day. You take some supplements of molasses with some lemon juice and water. You drink that first thing in the morning. You just add in that tablespoon, you have 13% of your daily need of calcium. Then you eat a meal, you have some collard greens, some rice, and some tofu. That alone for the day, you have over 56%. It don't take you 1 or 2 more meals and you get 1,000%. That's how you start your day. And say you still feel like you need a little help, you go and find the most natural supplement that you can find, and you take that supplement, and you probably add another 25, 30, 50, 100%, and that's how you get your supplementation. And normally, now if you're in demand, so you're under stress, you're working hard, you're exercising hard, whatever is going on in your life, and you feel like you need extra because you feel like you're not firing fast, you know the electrical impulses are not flowing as much, you go ahead and take another hit of the supplement, or get another cup of probably for lunch, another cup of broccoli. I've had people who gone to the doctor do a blood test, and their calcium, their magnesium, their iron level, primarily iron level, I should say, is down. Female, and I say, this is what you do. I want you to start doing 2 green leafy vegetables, fresh or steamed, on a daily basis. 1 for lunch, 1 for breakfast. And I want you to take some molasses with water and lemon juice once or twice a day. And within about 3 months, the person's iron levels are come back to normal. It really works. So you can do this if you, as I say, you throw in the almond, the mustard green, the sesame seed, 2 tablespoons of 210. So if somebody say, oh, Lloyd, I really want to make this happen, your sesame seed become your supplement, your molasses become your supplement. Because 2 tablespoons of sesame seed, 1 tablespoon of molasses, you're up to 34%, sorry, of your daily need. Just those 2 things. You throw them seed, you blend it probably in a blender, drink it down in the morning as a supplement. You get it in your stomach, and you have 30-something%. That's your supplement. And that's how you approach this type of stuff, and you will get the benefit that you need to get. And you cut out the dairy, cut out the junk out of your diet, and you'll find that your hip fracture, your bone fracture, all this stuff will go away. You lose some weight, that means you have less pressure on the bones. You'll be all right. You'll be all right. And, for full disclaimer, go talk to your doctor, since you have an agreement for health first. But I'm just suggesting this. This is what I would do, and this is what I'm doing more and more. Let's pray. Thank you, Lord, again for your love towards us and the blessings, dear Lord, of knowing you. Pray, dear Father, that we might continue to understand how best to take care of these machineries that you give us, that we may be in the best health and treat our body in the best way. May you be with us, dear Lord. We pray for Christ's sake. Amen. Well, thanks again for being with me here on Revive Reform Radio. Looking forward to talking to you tomorrow morning, where we should talk about current events. Until then, I pray that you may continue to walk with the King.